Hey, what's going on, guys? This is Tyler, and I'm a pharmacist with Pharmacy Update. Today, I wanted to talk about a medication that I dispense quite a bit of, Bupropion, or brand name Wellbutrin. I'm going to cover some basic information on Bupropion, including uses, the black box warning, and at the end of the video, I'm going to discuss the side effects. So if you or someone you know takes Bupropion, this information might be helpful for you. And with that, let's get into it. First off, what are the uses for bupropion? I'd say the majority of people taking this medication are taking it for depression. It can help with the physical and mental symptoms of depression. You can start feeling the improvement in physical symptoms within the first week of taking Wellbutrin. As far as the mental symptoms, it can take up to 4 to 6 weeks to get the full effect of the drug. So if you're mentally not feeling better after taking it for a couple days or weeks, just continue taking it because it can take some time. It's also approved to treat seasonal affective disorder, which is a depression that comes around the same time each year, usually during the winter time, and it's also approved to help people quit smoking. As far as off-label uses, bupropion can help with ADHD symptoms, bipolar depression, and SSRI-induced sexual dysfunction. That is one nice thing about Wellbutrin is that it does not have the sexual side effects associated with SSRIs such as Prozac. And it can actually help with these side effects if you are taking an SSRI. I do see many people that take both an SSRI and bupropion. The black box warning for bupropion, this is something you need to be aware of. And this applies to all antidepressants, not just this drug. But in short-term trials, they have found that taking an antidepressant can increase the risk of suicidal thoughts or behaviors. They have found this association in children, teenagers, and also young adults. As far as patients 65 years old and older, they have not found this association. So you really want to watch out for this when you are just starting out, or if one of your family or friends are starting an antidepressant. Monitor closely for any new signs or symptoms of worsening depression, suicidal thoughts, or behaviors. And if this does occur, please seek medical advice immediately. How does bupropion help with depression exactly? It is thought to work by weakly inhibiting the reuptake of dopamine and norepinephrine from the neuronal synapse. So if you look at this little diagram here, it helps illustrate how Wellbutrin works. The theory is that in depression, certain neurons in the brain are not communicating like they should be. So what happens, this neuron here releases serotonin, norepinephrine, and dopamine to be taken up by this neuron here. But very quickly, this neuron can reuptake these neurotransmitters. And what they think can happen for depressed people is that this reuptake can happen too quickly. So these neurons really aren't communicating as well as they should be. What bupropion does is inhibit the reuptake of two of these neurotransmitters, dopamine and norepinephrine or noradrenaline. It blocks these transmitters from going back into this neuron here. And by doing this, this neuron is receiving more of these neurotransmitters, causing better communication. And this is why they believe bupropion helps with depression symptoms. Hopefully that made sense. Bupropion is in a class of its own for antidepressants. Other antidepressants inhibit the reuptake of serotonin or norepinephrine for the most part. Wellbutrin is the only medication that blocks the uptake of dopamine and norepinephrine. Now I would like to cover the contraindications and precautions regarding bupropion. First here is the contraindications. So if you fall into any of these categories, you will not want to take this medication. Seizure disorder, so bupropion can increase the risk of seizures, so just be aware of that. Any history of anorexia or bulimia, this drug can cause weight loss. If you are currently discontinuing alcohol or sedative use, this kind of goes along with a seizure warning. If you are abruptly stopping these substances, that could increase your seizure risk possibly. Use of MAO inhibitors. These drugs are normally used for Parkinson's disease. Linezolid, which is a pretty powerful antibiotic, and methylene blue. This is normally used for medical scans. Some precautions to know before taking bupropion. It does cause central nervous system stimulation, so this can cause anxiety, restlessness, or insomnia. So if you're somebody with anxiety that goes along with your depression, This may not be the best option for you. Also, if you take bupropion only once a day, I would try to take it in the morning so you can avoid the insomnia. It can raise your blood pressure a little bit. It can also increase your heart rate for bipolar patients and can cause them to become manic or hypomanic. So just watch out for that. Mild pupil dilation. Bupropion can cause some neuropsychiatric events. So if you have any history of mental health disorders or psychosis, I would definitely use caution. And this last one here may be a positive for some people, weight loss. But for those who are not trying to lose weight, this may be an issue. Bupropion is actually one of the ingredients in Contrave, a weight loss medication. So depending on your situation, this may be a positive or a negative. And that brings me to my final topic of the day, side effects you could experience with bupropion. And I certainly didn't list every single side effect on here, just some of the more common ones. Probably the most common side effect you could see is headache. This can happen in up to a third of patients. Dry mouth is also pretty common. I already discussed a little bit about tachycardia or an increased heart rate. This can be a big issue with some people, and it is the reason some people have to discontinue Wellbutrin. Insomnia I already talked about, and it is quite common. You can also see sweating, nausea and vomiting, constipation in up to 26% of people. Lack of concentration and tremors are also possible. Well, that's all I have for today, guys. I hope you enjoyed the video. Please leave a like if you thought it was helpful. If you'd like to keep up on the latest pharmacy and medical updates, please subscribe to the channel. I also post drug reviews such as this one. I'd also like to hear from you guys. What were your experiences with bupropion? Did it help with your depression? Did you experience any side effects? Please let me know in the comments below. So I hope you guys have a nice day, and we'll see you next time.